Today on Investigate TV, you put your life in doctors' hands, but the system designed to keep physicians in check could be keeping secrets from you, ones that may impact your treatment.
An impaired doctor practicing medicine poses a risk to their patients.
Plus, nonprofit hospitals claim they're taking a financial hit treating Medicare patients. But a new report says some hospitals are making millions off Medicare.
They are misleading. It's impossible to tell why their numbers are so different.
Investigate TV starts right now. Hello and welcome to Investigate TV. I'm Lee Zurich. The state programs helping doctors battle addiction are cloaked in secrecy, and that privacy often encourages physicians to seek help. But critics argue it's at odds with patients' rights, and the public should know about physicians in recovery. Josie Sturman investigates private practice, route to rehab.
When it comes to your doctor, you tell them everything they need to know to make decisions that protect your health. But what happens when doctors are keeping their own secrets, ones that could impact their practice?
It does not take a lot of thought or brains to figure out that an impaired doctor practicing medicine poses a risk to their patients.
Yet it's a real risk faced by patients across the country. Researchers estimate 1 in 10 physicians will struggle with drug or alcohol abuse at some point in their career. And a recent survey discovered 14% of doctors admitted to drinking alcohol or using controlled substances at work, with experts saying the stress of the profession and the access to prescriptions putting doctors in a unique position.
Despite the fact that we might like to think of them as superheroes, they get sick like everybody else. And when they do, the option for therapy and treatment should be available to them just like any other patient.
In almost every state in D.C., specific treatment for addicted doctors is handled by something known as a physician health program, or PHP. They're not physical detox or rehab facilities, but rather specialized treatment, monitoring, and oversight plans often run by state organizations, working to get physicians the help they need to hopefully return to practice. But those programs are largely secretive. A doctor's enrollment is not shared publicly, no matter how severe the reason they've ended up in the PHP. Our national investigative team spent the last 2 months digging in to see how it all works. We discovered a system that supporters say gives doctors a confidential alternative to discipline while still guarding public safety. But critics argue it puts the protection of doctor reputations ahead of a patient's right to know.
I feel like they do have the right to know because they have the power to change your health outcomes.
Julie Pace has seen behind the curtain of the PHP system and came to us with concerns about the secrecy of the program and how it impacts the public. She was married to a doctor in recovery for substance abuse. It was this man, Dr. James Michael Pace, who we found behind his desk at his solo practice in Mississippi. He wouldn't speak with us then and didn't respond to specific questions sent in 4 emails in the last 2 months. But documents supplied to us by his former wife pull back the curtain on the PHP process.
If people look at Dr. Pace's record, what do they see?
Nothing. Clean slate.
That's not what's in the public paper trail, although Dr. Pace is not the one responsible for hiding it. The program is confidential. But records Julie provided show he was first enrolled in his state's PHP in 2003. Pace has signed several program contracts since then, agreeing to abstain completely from alcohol and mood-altering substances, or risk being immediately reported to the Mississippi Medical Board for discipline. But court records show Dr. Pace relapsed and had 2 lengthy stays in rehab in 2018 and 2020, although there's no indication he was ever impaired at work or had patient complaints. It appears Pace didn't practice medicine for a period of time and even testified he had to reapply for his license at one point. But you won't find any of that on his public profile on the medical board website.
I believe everybody deserves second chances, don't get me wrong, and no one's perfect. But a pattern of behavior is a definite cause for concern. They should know about that. I would want to know. There should be some transparency. There should be accountability.
There's no reporting listed, no discipline, and no change in his status. Although we did uncover tax filings that show Dr. Pace served on his PHP's board and even acted as the associate medical director before he relapsed in 2018. His case is just one example of what can happen behind the scenes, with little showing up in the public record that patients can access. Even basic statistics are hard to come by in this system where confidentiality is a core value. Since PHPs don't disclose information, our team went state by state, asking medical boards how many doctors they've sent to health programs. Only 22 would provide information. We ultimately discovered at least 1,000 physicians from those states have been referred to PHPs by their medical board since the start of 2020, including doctors whose public board discipline records show have been charged with DUI on the way to work, some testing positive for drugs, slurring and stumbling on the job, even admitting to drinking daily while working with patients.
It is a major problem.
It's a problem Dr. Sidney Wolf with the consumer advocacy group Public Citizen says needs to be addressed with patient concerns put first.
At what point do you believe the public has a right to know?
Since you're placing your health and life in their hands, they should know as much as possible. It is not an intrusion on the doctor to let the patient know that this is what they did.
But our nationwide look at PHPs shows the identities of physicians are zealously protected in these confidential programs, with written permission often needed from the doctors being treated to release any information, even when they're being routinely drug screened, monitored, and practicing with a list of conditions following treatment. And as many of their websites show, the PHPs often have no obligation and won't always report to the medical board when doctors don't follow the rules, unless there's an immediate threat to safety or specific patient harm.
Why wait until someone has been harmed? The imminent danger almost always means someone's been harmed, damaged, or killed in some cases because you didn't catch them earlier on. So why are the rehab organizations not automatically notifying a medical board? And that's because the state medical associations don't like the idea.
State medical associations, or societies, as Wolf points out, are doctor-funded lobbying organizations that play a powerful role in shaping the policies that determine how physicians are licensed, monitored, and policed. Our investigation discovered those groups run or have links to at least 17 of the PHPs across the nation.
And the rehab programs are not going to be likely to do something that will offend the doctors, namely report the progress or the existence of a doctor licensed in that state in a rehab program. They're not going to like that.
If your physician is at a point where they're being drug screened and supervised, he believes the public has a right to know at that point. Do you agree or disagree?
Yeah, I would disagree.
Why?
Just because I think on balance that will discourage individuals from seeking care and treatment and will put the public at greater risk.
Dr. Chris Bundy is the executive medical director of Washington's PHP and the immediate past president of the Federation of State Physician Health Programs. He says without a confidential option to seek treatment, sick doctors may stay underground and keep practicing until their illness progresses to actual impairment on the job.
And you have to understand that one of the primary motivations for individuals to engage in these programs and remain compliant with the program is that they know that if they're not, confidentiality will be lost. So that confidentiality is actually a powerful motivator for the compliance that we see in the program.
The programs, Bundy says, yield gold standard results when doctors dealing with substance abuse participate and are monitored by PHPs. Studies show abstinence rates approaching 90% at the end of 5 years. But when there is a failure, Bundy says that doesn't automatically mean a doctor has put patients at risk.
It just means that they haven't complied with the terms of the agreement. But again, illness does not equal impairment. I think overall, the system has supported the idea that these confidential programs ultimately benefit patients and patient safety.
But people like Julie Pace say doctors still reap the greatest benefit from the lack of transparency in the system.
When all of this happens behind closed doors, what does it do to the public's trust in the medical industry?
Total distrust. Yeah, they don't really trust anything. They're putting their health in your hands, basically, to make decisions for them. They should have the right to know if you've struggled with anything, I feel like. And then they can make their own decision if they want to continue to see you or not.
Both the Mississippi Licensing Board and the director of the PHP in Mississippi declined our request for comment, saying they can't talk about specific licensees. Coming up, more on discipline for doctors struggling with addiction. We hear from a patient who says he suffered 2 disastrous surgeries. His doctor was investigated for being impaired while operating.
To be so quickly reinstated after some of the things he's done, it makes absolutely no sense.
That's after the break. Welcome back to Investigate TV. When doctors put the public at risk, it's up to state medical boards to take action. But a lenient system is allowing physicians to keep their licenses even when they show up to work impaired. Josie Sturman has more.
Next case, Michael Heilig.
In November 2018, members of Kentucky's medical board took just 5 seconds to make what many consider a surprising decision.
All in favor? Any opposed? Motion granted.
Fully reinstating the medical license of this man, orthopedic surgeon Michael Heilig.
Well, I was just shocked.
The news was stunning to Danny Davis, who told our Lexington station back then he learned through a flyer in the mail that the doctor he claims did 2 disastrous surgeries on his arm was back in business.
To be so quickly reinstated after some of the things he's done, it makes absolutely no sense.
Medical board documents say Heilig failed a hospital drug screen in May 2018 after a nurse raised concerns he was impaired in the operating room. But even though records show Heilig had been self-prescribing Ambien, was diagnosed with 2 substance use disorders, and signed a contract with a special state program designed to monitor doctors battling addiction, his license was not suspended or revoked.
It's the kind of situation our national investigative team has seen across the country. We've spent months digging into discipline and oversight for doctors dealing with addiction and alcohol abuse, discovering a secretive process that critics say protects doctor reputations while leaving patients in the dark. Time lags in informing medical boards and the public about doctors who have significant issues, and lacks delayed punishments for physicians who've put people at risk while battling their own demons.
It's a serious threat to patients.
A threat Dr. Sidney Wolf with the consumer advocacy group Public Citizen explained is often tackled first with confidential physician health programs, or PHPs, that give addicted doctors an avenue to get clean and sober while potentially avoiding discipline. But we've found their identities are generally kept secret when they're in a PHP, even when they're cleared to return to work.
Would you knowingly go to a doctor who you know had recently a problem with drug or alcohol abuse? Most people would say no.
But generally, people don't know about doctors in rehab or recovery unless there's an imminent risk to the public or until a doctor repeatedly breaks the rules laid out by their PHP. That's when state medical boards are typically informed, and they may hand down public disciplinary action.
Amongst the categories that I think are most outrageous and dangerous is the failure to act more promptly and more completely against those doctors with substance abuse disorders.
Our national investigative team looked at actions taken against impaired physicians or physicians in recovery across the country, discovering when it comes to PHPs informing medical boards about noncompliance, some doctors got multiple chances before boards were told they weren't following program rules. That includes an Indiana family medicine doctor who was enrolled in his state's PHP in 2018 following drug abuse treatment. Records show he failed 3 required drug tests in 2019 before the state board was ever informed, and his license was only suspended after he was charged with 2 DUIs in 2020. He later retired.
The boards have to be tough when people fail to manage their addictions.
Firm, fast action is what's warranted in these cases, according to Art Kaplan with NYU Medical School, one of the country's leading medical ethicists. But we found revocations are rare, and even extreme cases don't always have swift, strong consequences. In 2020, board documents show a Wisconsin doctor who reported drinking before work, driving intoxicated, and treating patients while in active withdrawals went to rehab and enrolled in his state's PHP. Even though the records say he started drinking daily and dropped out of the program in 2021 and was later fired for on-the-job impairment in January of this year, he wasn't disciplined until June. And he got a suspension that was lifted just 2 months later.
I believe that we're leaning too hard right now in many states to protect the physician's interests first.
Back in Kentucky, one of Heilig's attorneys told us Dr. Heilig is a long-standing member of the medical profession whose priority is providing exceptional care and treatment to his patients. He is back on the board's radar. In late November, it labeled Heilig an imminent danger after records show he tested positive for fentanyl in June. And his state investigation in August found his practice was operating like a pill mill. He's not allowed to perform surgery or prescribe drugs, but Heilig can still practice medicine if he abstains from drugs and alcohol, as his license was restricted, not suspended. The reason and delay, yet another mystery in a doctor discipline system that puts the emphasis on private practice.
The Federation of State Medical Boards declined multiple on-camera interview requests and did not answer specific questions about the discipline of addicted doctors. In a statement, the group said the primary mission of state medical boards is to protect the public by ensuring physicians are properly licensed, trained, and fit to practice. It also said boards have a responsibility to support physician wellness because public safety depends in part on physician health. Up next, nonprofit hospitals say they lose money on Medicare reimbursements, but one study says in North Carolina, some hospitals profited off Medicare patients. We explain after the break. Welcome back to Investigate TV. Healthcare costs are rising and Americans are struggling. According to the Kaiser Family Foundation, roughly 40% of adults say they've delayed or foregone care because they couldn't afford it. Nonprofit hospitals claim they charge privately insured patients more to make up for losses on Medicare reimbursements. But a new report says some hospitals are making money off Medicare. David Hodges in Charlotte, North Carolina, has the details.
I was shocked because I felt like they serving me this now when all them years I thought it was taken care of.
WBTV interviewed Patricia Durham about the lawsuit she was facing from Atrium Health for a medical bill more than a decade old that cost her more than $40,000.
How can they set me up on a payment plan when I ain't got no money to do a payment plan?
In response to WBTV's reporting on lawsuits and collection practices on medical debt, Atrium Health has mentioned how much free and uncompensated care it offers, which includes hundreds of millions of dollars in what the hospital system claims is unreimbursed costs from Medicare.
They are misleading. It's impossible to tell why their numbers are so different.
In a news conference, officials from the North Carolina Treasurer's Office, the State Health Plan, and Rice University unveiled a new report disputing North Carolina hospitals' reported Medicare losses. Data reported by the hospitals, but on different forms to different government departments, showed the discrepancy. The report finds that while Atrium reported Medicare losses of $640 million on one form, on another, it claimed nearly $120 million in profit in 2019. The number matters because it impacts how much you pay for health insurance and how much your employer charges you for that insurance.
Literally, there are millions of people who will never see a raise at their job because the premium cost next year to their employer will eat up any increases in productivity.
Not only are employers and the state paying too much for their health insurance, but it is also the case that it seems that North Carolinians are losing out on community benefits that these nonprofit hospitals should be contributing back to the public because of the tax breaks they receive.
North Carolina Treasurer Dale Falwell says instead of community benefits, the money goes to growing bigger hospital systems, which he calls the cartel.
Atrium Health, who's the biggest player of the cartel in North Carolina, has over $12 billion in the bank this morning. So these hospitals have lost their mission. They have turned into investment banking, real estate development companies.
An Atrium Health spokesperson wrote in an email that the report appears to be based on a completely false premise and thus incorrect conclusions. The email points at numerous filings that are not included in the report because researchers didn't have access to them. Atrium also claims it recorded losses from Medicare more recently than what was included in the report. It says our most recent required filing of Medicare cost reports to the federal government clearly indicates that through the care that was provided at our hospital facilities in North Carolina, Atrium Health incurred unfunded costs of $85 million. And even if you're not admitted to the hospital, a simple doctor's visit can be a real hit to your wallet. We have tips on budgeting for medical bills after the break. Stick with us. You're watching Investigate TV. Welcome back to Investigate TV. As we noted earlier, for many Americans, a trip to the doctor is determined by the cost of the visit instead of the medical need. Rachel DePompa shares ways you can keep your appointments while still finding ways to save.
A new study from myvision.org revealed 61% of people say they've avoided the doctor because of the cost. 44% of those surveyed say they are overdue for their annual checkups. Maria Shatkowski worked on the report for My Vision, a website that helps answer questions about eye health. She says besides worries over cost, a lot of people said they were having trouble getting appointments. She experienced it too. The pandemic forced many people to delay routine checkups.
There's been so much catch up having to be played by these offices that it's just hard to schedule an appointment because now everyone can go back and see their doctor where maybe they had to put it off for, a year or two.
So what can you do to get in the habit of regular checkups without fears of the cost? Experts admit estimating the cost of a doctor's visit can be challenging, especially for folks with a high deductible or those with no insurance at all. One way to avoid medical debt is to contribute to a health savings account or flexible spending account. HSAs and FSAs allow you to put money directly from your paycheck tax-free into a dedicated account to be used for out-of-pocket healthcare costs. And if you don't have an option like that, experts say consider using a savings account, or better yet, creating a savings account specifically for health expenses. With this, Watching Your Wallet, I'm Rachel DePompa.
Thanks, Rachel. If you're looking for more investigative reporting on demand, download our streaming apps on Roku, Apple TV, and Amazon Fire TV. You can also follow us on social media at Investigate TV on Facebook, Instagram, and Twitter. And that's it for us. Thanks for watching us here on Investigate TV. We'll see you next week.